Good afternoon, everybody. It's Dr. Mark here. I had a quick little update I wanted to share with you regarding a case report that just came out in this week's edition of the Journal of Upper Cervical Chiropractic Research, and it's titled Improvement in Quality of Life, Sleep, and Attention in a Patient with Attention Deficit Disorder Undergoing Upper Cervical Chiropractic Care. And if you guys remember from your visits here in the office, that upper cervical chiropractic care is about balancing that first vertebrae of the neck, sometimes the second vertebrae of the neck, those two upper cervical vertebrae, to make sure that there's a healthy, strong connection between brain and body. And that's one of the cool things that they really mentioned in this article is that connection between chiropractic and brain function, and they actually measured it with some magnetic resonant imaging, some MRI imaging, and found a great changes in some of the characteristics of prefrontal cortex function that they measured. And for those of you that don't know, the ADD, ADHD is primarily a condition involving brain function, or actually misfiring of the prefrontal cortex part of the brain. It's the part of the brain that helps us control our impulses, have attention, create thought patterns, helps to play a role in mood, and all kinds of other things that go on in our daily activities to help us live a high quality of life. When the prefrontal cortex is firing the way it's supposed to, it helps us enjoy a high quality of life. And kids and adults with ADD, ADHD have a misfiring in that portion of their brain. Now, one of the interesting things that we know through basic science research is that the prefrontal cortex needs a lot of information coming into it, a lot of sensory information. And you can disrupt a lot of those different impulses coming from different parts of the brain. But one part in particular that can alter prefrontal cortex firing or function is sensory input that comes from, you guessed it, the spinal cord, actually the dorsal horn of the spinal cord, which is the tract that carries all that sensory information coming from our body and from our environment that travels through the spine. So obviously, if that part of the spine is not working correctly and it disrupts dorsal horn function, then what? The prefrontal cortex can't fire the way it's supposed to. So by balancing the upper cervical spine and helping the body to maintain proper alignment and, more importantly, proper function so that it can stimulate the brain the way it's supposed to, you can have a drastic effect on ADD, ADHD, and other neurobehavioral conditions that we'll talk about a little bit more over the next couple weeks, next couple months. But some of the cool things that were mentioned in this research article is that it wasn't just subjective things like the gentleman saying he felt better or was feeling better, and his parents maybe noticing things changing. But Dr. Dick Holtz actually, who was the chiropractor in the study, he actually had the gentleman use an SF-36 as well as some other very standardized, very well accepted clinical outcome studies or questionnaires, to help track their progress. And the SF-36 measures things from the way the person feels and how much pain they have to their social function, to their quality of life. It asks questions in all those different categories. And they noticed that over a 10-month period when they were doing the questionnaires with this gentleman, he improved every single time they did a questionnaire. And at the 10th, at month number 10, when they did the fourth installment of the SF-36 with him, he had reached a perfect score in all 6 categories. So it's really exciting not only for him, but also for the implications that that may have for a lot of other people that are dealing with neurobehavioral conditions such as ADD, ADHD, and the connection between upper cervical chiropractic care and keeping a balanced spine and a balanced brain-body connection so that the brain works the way it's supposed to, and those people can enjoy a higher quality of life. So make sure you share this information in this video with anybody that you might know that's dealing with those conditions, as well as people that are looking for a non-drug way of living a higher quality of life and really living a life of their full potential. Thanks for listening and watching, and I look forward to seeing you in the office soon. Have a great day. Take care.